There is a lot of good information, but there is also some information that's not exactly correct. So probably the best thing is when you go to get your vaccine, be sure that you're on time. And if you're going for your second dose, make sure you take your CDC card with you so that can be completed. But you also want to make sure that you've had something to eat, that you've had good nutrition. You want to make sure that you're well hydrated. And then it is not necessary to take any kind of medication such as acetaminophen or Tylenol or ibuprofen or any of those medications prior to you getting the vaccine. It's actually recommended to not do that. But afterwards, if you are noticing any symptoms, if you notice a headache, if you notice a little bit of fever, then at that point in time, you can take one of those medications. But it's just not necessary to do that ahead of time.
Okay, so the key is with the COVID-19 vaccine, by having some of those symptoms, a headache or maybe nausea or something like that, may indicate that the vaccine is doing what it's supposed to do. So you're saying don't take any pain relief before you go get the vaccine so you can kind of see what your body, how it's responding?
That is right, because you really do want to see some sort of immune response. In fact, a lot of times, rather than calling them side effects, I typically do call them immune responses because it is really your body saying, I am ready to fight this COVID virus. And so, a little bit of headache, a little bit of fever, a little bit of nausea, anything along those lines, that's showing that your body is ready to fight the virus.
Now, once the first vaccine is administered, and I suspect the second as well, there's a 15-minute waiting period after you've been injected. So people go home, and you talked about some of the more mild reactions, immune responses. At what point can someone say, gee, this is not normal, I need to contact a physician?
That's a great question. And you would want to contact your physician if you notice that your fever is greater than 100.4. You would also want to contact your physician if you notice that you're having any kind of difficulty breathing, if you're having significant itching. And a lot of times what we've seen is a little bit of itching around the injection site. But if this is much more pronounced, or if you notice any significant swelling around the injection site, at that point in time, you would want to contact your physician because there may be some prescription medications that might be used, or it may be one of those things where it's like, just wait a couple more days and see if it goes away.
Gotcha. And this advice is good regardless of which vaccine you should receive, either the Moderna or the Pfizer at this point.
Yes, actually, the immune responses or side effects from the two vaccines are very similar. And so really, it doesn't matter which one that you get. You'll have similar types of side effects from both.
Okay, as one of the premier vaccine sites in the region, the Bowling Green Medical Center, and you are the Vice President of Corporate Support Services there, how is the vaccination effort going in this region?
Oh, Barb, I cannot tell you how wonderful it's going. I am so pleased with the response from our community. And when I say community, I'm actually talking about the entire region because we've had people come from miles away in order to be able to get a vaccine. So it's been really, really good. In fact, just at the Bowling Green location, through Sunday, we had given over 28,000 doses just at the Bowling Green site. So that's tremendous. And that's both first doses and second doses. That's total. But, that really just shows me that our community is ready to get back to normal, to not have to wear masks, to be able to have activities and gatherings. So I'm so pleased with what we're seeing.
Thank you so much. Melinda Joyce is the Vice President of Corporate Support Services with MedCenter Health. And I'm Barbara Deeb. You can keep the conversation going. Melinda, we always do this little corny thing at the end of our discussions and our conversations, but in the event that you could have coffee with anyone, living or dead, who would that be?
Oh, gee, Barbara, that's a great question. Probably the person that I would, these days, I'll tell you, the person that I would most like to have coffee with is Dr. Rebecca Shadowin. I miss her so very much, and I would love to be able to have coffee with her again.
Melinda, you stay well, and thank you for your time. Thanks.
Thank you.